Hello, everyone, and welcome to another edition of the UHN Foundation COVID-19 virtual Q&A. We hope you are staying safe and taking care of each other as we begin to see the light at the end of the tunnel for the pandemic. I'm Susy Hota, host of the UHN podcast, Behind the Breakthrough, and we're so glad you could join us. We're grateful also to you our family of supporters who've been so supportive since the beginning of the pandemic. So a big thank you on behalf of the foundation and all of UHN. This episode, we're focusing on vaccine protection against the variants of concern, getting your second dose, and the wisdom of a vaccine passport. Plus, we'll be taking your question, as always, in the back half of the show. With us today, we're so pleased to be joined by Dr. Susy Hota, Medical Director of Infection Prevention and Control at UHN. Welcome, Dr. Hota.
Thanks for having me today.
Let's start with AstraZeneca. There's a lot of confusion for people out there whose first dose was the AstraZeneca vaccine, about 2 million Canadians. I understand today the National Advisory Committee on Immunization is now recommending your second dose be an mRNA vaccine. What's your guidance based on the latest science that's available out there, Dr. Hota?
Yes, this is quite a new development. So I guess we're starting off with breaking news that the NACI Immunization Advisory Committee has actually put out a specific recommendation saying if you got AstraZeneca first dose, you should be getting an mRNA vaccine. That would be either Pfizer or Moderna for your second dose. And I think what this is based upon is a growing body of evidence that's emerging from Europe, primarily, where they've been doing this a little bit more, that shows that the immune response when you've had AstraZeneca followed by one of the mRNA vaccines, particularly Pfizer, which is what they mostly use in Europe, it seems to be stronger. And theoretically, you can see how having two different types of vaccines that work slightly differently can actually have more of a broad immune response that your body would be responding to. So that's where it's coming from. There have been 3 studies, one in Germany, one in the UK, one in Spain, that have actually shown that not only is it looking safe to do so, but you actually have a better immune response. And what we're waiting for now is a clinical trial out of the UK that is specifically designed to answer this question and look at how people do clinically after having had both different types of doses compared to if they got AstraZeneca, or Pfizer. So what is the risk of infection down the road? And hopefully those results will also be available later this month or by next month.
And it's encouraging to see this week that more than 75% of Ontarians have their first dose of the vaccine. But because of the severity of the variants of concern, the Delta variant in particular, we're hearing we need first doses to reach 90%. Is that now what we should consider the new benchmark for herd immunity?
It's really, really tough. Every time a new variant comes onto the landscape, it seems like the game changes. And that's what we're dealing with now with the Delta variant, which is now coming up to being probably more than 50% of what we're seeing in Ontario. We've seen some data from the UK that's showing that it's likely about 60% more transmissible than the variant that we had predominantly before Delta, which is now considered Alpha variant, and the one that first arose out of the UK. That in itself was more transmissible than the earlier variants of COVID-19, the SARS-CoV-2 virus, which causes COVID-19. So as you can see, it just keeps changing. And the more transmissible the virus is, the more you need to protect the public and the higher your sort of threshold would be in order to reach what we would call herd immunity. And herd immunity is becoming, in my opinion, more and more problematic to talk about because, the whole essence of it is if you have enough people who are vaccinated and immune, you can stop the transmission of the virus. It just hits a wall basically so that you're protecting those around them who, for medical reasons or other reasons, such as age, young children, for example, are not able to get immunized themselves. And so when we're talking about really high levels like that, I think we have a chance of reaching 80, maybe even 90% immunization if we work really hard within Canada, but it does sound a bit daunting. And I think it's tough for people to swallow that number. So I've been kind of steering away from that conversation, really just focusing on what our goal is, which is enhancing vaccination levels as much as possible across the board.
Right, just get it done. Now, with 75% of Ontarians vaccinated, that still leaves 25% unvaccinated. What's your sense here? Is this now, are we hitting hesitancy, do you think, or is there still momentum in terms of people getting their first dose?
So that 25% represents a bit of a mixed bag. There are some individuals who just won't get vaccinated. They don't believe in it. There are reasons why, and it's fixed. And I think that's a smaller proportion of people, but it's still a important group of people to be aware of. And we've been seeing that number of what we call sort of, for lack of a better term, anti-vaxxers. That was a growing problem even before this pandemic hit. So I think there's some work that needs to continue beyond this pandemic with that within that group. But then there's the vaccine hesitant, and I think this is where the opportunity lies. These are people who, for structural reasons, such as their inability to actually access the vaccine because perhaps they're working two jobs and they have childcare needs and other things, it's just been really difficult for them to get there. And we still have some of that. The booking systems are not easy for everyone to use, so that's a bit of a barrier. But also some people who have outstanding questions, they just don't feel they're getting the information that they need to make a good informed decision. And that's where the opportunity is. We can take down those problems. We can help to inform people. It takes a lot of effort, but it's really worth it. And every time we reach out and try to do that engagement to build confidence in vaccines, we get a few more people who feel comfortable and move forward. And so that's where a lot of the concentration of effort is. And for those structural barriers that are making it hard, having mobile teams come and actually give people vaccine where they work, where they live, that's been incredibly useful as well for some of those populations.
When you talk about that engagement, I'm curious if do you have kind of a rule of thumb or perhaps some advice that for all of us who, if we ever come across someone who's hesitant, that perhaps could be useful or successful in convincing them or changing their mind?
People have different concerns around the vaccine. Some are rooted in safety, some are about how they're developed, some are just confused because think about all the different messages we've gotten over time with different vaccines as we've been learning along the way. One of the disadvantages of just how rapidly we were able to successfully get vaccines out onto the market and into people's arms is the fact that the longer term sort of monitoring was not completed like we would normally do with many other vaccines. And that's not a bad thing. It's a good thing that we're able to respond to this pandemic so quickly with these vaccines. But it also means that the information we're providing people is constantly evolving. That is not good for somebody who's already feeling a bit uncertain about the concept of getting vaccinated. So I think that pointing people to the right sources of information is really important. I want to make a comment that there's still a lot of misinformation out there about vaccines and about a number of other issues around COVID-19. So credible sources of information, and nothing replaces being able to speak to a person who understands the vaccines. And I think that's a really important a role that many of us who are in the world of infectious diseases and public health can actually play.
Absolutely. I'm curious on your take of provinces such as Manitoba and Alberta who have announced lotteries to incentivize people to get vaccinated. Is that something we should be considering?
I think incentives can be really helpful. I mean, it's worked in some areas, at least for a small number of people, it's bumped up the numbers. The only challenge with the incentives are you have to keep up with it, and then you keep raising the bar because expectations go up, right? So these are 2-dose regimens as well. So I worry a little bit that people may come forward if they're incentivized the first time, and if there isn't an equally compelling incentive the second time, we might lose the second doses. And second doses are becoming more and more critical as we move forward. So I think that we have to be strong in that messaging. So if it's done well and carefully, and if it's done in a way that is equitable, so it applies to everybody as best as possible, then I think I have no problem with it.
Let's turn to second doses and the protection you get from the virus from a second dose of the vaccine. Some, you hear little ripples out there of some people thinking, I can get by with 1 dose. What would you say to them?
Oh, so, a single dose of the vaccine, we used to say it would give you moderate to good protection against the virus 3 weeks out. But getting that second dose boosts that response, and it also gives you a more durable response. all of that's changing as the variants come, different variants come forward. So with previous variants, that may have been the case, at least with the dominant ones. With the Delta variant, which is rising in incidence here, that is not the case. The second dose is really, really important. So what we know is whether you got AstraZeneca or Pfizer, this is data from the UK, where those are the two vaccines that they primarily have administered. One dose of the vaccine only protects 33% of people. It's the second dose that really bumps it up to, in the case of AstraZeneca, it was 60% protection against symptomatic infection, but actually 92% protection against hospitalization from COVID-19. And for Pfizer, you'd go up to 88% protection from symptomatic infection after the second dose and 96% protection from hospitalization. So you can see what a difference that second dose makes. And certainly that's experience that other countries are having where, until they can get their second dose coverage up, you remain susceptible to this Delta variant causing problems.
Well, and this Delta variant has raised the urgency, I'm guessing, of getting the second dose, especially say when you look at the British experience. The speed of the Delta transmissibility apparently means you only have, like, say, a 4 to 6 week window before it could take off. So I'm curious, with Ontario sitting at about 20% of people with 2 doses, and today we have 10 Delta hotspots across the province, are we in a precarious situation here where this variant could take off?
In my opinion, it feels like we're always in a bit of a precarious position. There are a few things that are happening at the same time. One is we're rolling out vaccination. We're doing an excellent job. We just have to keep at it, and we need people to continue to feel enthusiastic about it and not let their guards come down as they start to feel more protected with a single dose, and even shortly after a second dose. Keep with the public health measures after you've received your vaccine. Follow what the recommendations are broadly for public health, because we're dealing with a population level problem. If this Delta variant takes off, we all have to do something and play a role to try and prevent it from really getting transmitted from one person to another. The second thing is about the variants. So what's happening with the different variants? And for a while there, I was feeling a bit optimistic that Delta was kind of holding its ground within Ontario, but not really taking off. And that's changed in the last week. It certainly is rising, and it's starting to rise at that exponential pace. So, whereas it was a slower growth, it's taking off more. Now, the good news is the overall number of cases in Ontario is continuing to decline at the moment. We just worry that if we take our eye off the ball, we're going to miss the signals of an early increase in cases. So we have to watch the numbers really carefully and react quickly. The third factor is, of course, we're starting to try to reopen in the province. We've been closed down, especially in the Greater Toronto area, for over 6 months in some form. And I think we're ready to try some reopening, but we absolutely have to do this cautiously. And we have to wait enough time between each of the steps of kind of opening further before we proceed. Because, like I said, we can miss some of these signals if vaccination is not able to keep up with what's needed to control interruption of transmission of Delta. There's one other factor that I've been kind of mulling over a little bit, and that's the fact that we've been rolling out vaccination over a period of time, and now it's actually many months. Some of us who were vaccinated in the early days through, long-term care work and things like that, we're coming close to 6 months since we've had our first and second dose. And so it's, a growing concern in my mind that we don't really know how long the vaccines provide protection yet. We'll hopefully get some of that information over time. But there are going to be potentially some people who are going to be susceptible because their immunity's waned. And so we have to start thinking about, what about booster shots, and how do we continue to maintain that protection as well?
Yes. You mentioned the reopening. The phase reopening has now started in Ontario. After 3 progressively worse waves, we know how delicate this dance is in terms of getting back to some normalcy, but also public health protection. And apparently today, Dr. Peter Juni of the Ontario Science Advisory Table warned, he said, quote, "We can still mess this up." What's your sense of the risk factors given where we're at today?
My biggest concern is that everyone is so fed up with this pandemic that should we see that signal that I keep saying we can't ignore and we have to be really aware of, is like acutely aware of, should we see that signal, I don't know how well it will go having to reinstitute some kinds of additional restrictions. That is really our only tool. It's a blunt tool, but it works to try and stop the transmission. And do whatever else we can do, such as enhanced vaccination if we still haven't gotten there. It buys us time. It's really not palatable for anybody at the moment, and understandably so, but it's really what we would have to do. So that's where I'm sort of sitting at the edge of my seat, a little bit worried about the reopening is I feel like we have to. You got to pull the trigger at some point. You got to do it. We can't live like this forever, and we're doing a great job with the vaccination. But at the same time, there's always that, voice in the back of the head that says, if something happens, however, you're going to have to, we're going to have to go that way. We're going to have to pull the restrictions out again. And I don't know how the public will respond to that. So to me, that's one of the biggest threats that's kind of looming over us right now.
In the meantime, if we are fully vaccinated, I know there's more calls out there for some kind of guidelines for how to behave until we get to whatever you want to call it, if you don't like the term herd immunity, but where we have a significant or a sufficient number of people fully vaccinated. The US CDC came out with some guidelines, and people are calling for that in Canada. What's your take on this in terms of what should that behavior be?
It's a really complicated one. I feel like it's likely to come out like some level of individualized recommendations, what you can or cannot do after you've been fully vaccinated. Because I think, for some things, like, can I hug my loved one, my grandparent, my whatever it may be, we need to hear that. And I think we can provide some of that kind of advice. The challenge is it's a bit of a slippery slope because we have a reopening plan that's based upon population level thresholds that we have to achieve. And it also progresses on a population level. And that's the approach we've taken throughout this pandemic in Canada. All the provinces have, the entire nation has. The US has been a little bit different from the start. Another thing to make note of is the US does not have the same degree of Delta variant as we do. So they're perhaps not in the same precarious situation as we are at this very moment in Ontario. What I worry a little bit about, although, like I said, we do need to have some of this advice, is that people will just start taking too much into their own hands, and we might lose that sense of, for lack of a better word, control over what's happening with the situation. And so that's really what we have to balance as we start getting some of that advice out for people to be able to live a little bit more openly and with a little bit more freedom. We still have to emphasize some of those important public health measures, like keeping masks on in indoor settings, things like that. And I just worry about losing that message.
Do you have a sense, Dr. Hota? I don't know if this is coming, but have you heard anything about, is such a guideline coming?
It's certainly come up at multiple tables, both on a national level, on a provincial level. I believe something will come out, but I can't say for certain. It just makes sense. The pressure is mounting, as you said, and it would be helpful to have some. It's a matter of trying to strike that balance again of, keeping to the plan that's being issued in your province. At the same time, this is what makes sense from a risk perspective because of your personal circumstances. So that's the difficult balance they're going to have to get into the message without confusing people.
So in the meantime, you hear stories of sort of businesses and, say, universities doing their own thing, right? Like they're requiring proof of vaccination from employees or faculty and students. Manitoba recently announced it is going to require a proof of vaccination passport. What do you think of the wisdom of some kind of proof of virus vaccination for all Canadians?
There are pros and cons to it. It helps us to, I think, have confidence for people to feel safe when they're, in an environment where they could be more exposed to other people, and that's helpful. The challenges will be having a system in place that's easily recognizable, that can't be faked, and there will be black market passports. You can be guaranteed of that. So, how to enforce it and make sure that it's being done consistently and properly, that's going to be a big thing that needs to be worked through. And then applying, I think that would make sense when we are sure that we've had equal access across the country to vaccines. So when we're at a point where every Canadian who wants their dose, their 2 doses, have had an opportunity to have their 2 doses, then we're at a point where the rest, it's up to your decision, right? Like, you've made your decision. And I think that it's a bit of a fairer landscape to institute something like a passport system. While we're still rolling it out and some places are having access problems to vaccine, it's a bit trickier to me, because the people who are able to get the vaccine have an advantage over those who've been trying but have been waiting in line for hours and had to go to work, and so things like that. So that's where I think the whole concept of vaccine passports sits at the moment.
There's a cohort of Ontarians out there who are still unvaccinated, and not in the foreseeable future will they get vaccinated, and that's kids under 12, which by projection, I understand that's close to 1 million kids, many of whom will be congregating in schools in the fall should in-class teaching resume. What's your advice to parents in this situation?
I am one of those parents. I have 2 young kids under the age of 12, and yeah, it's you can't help but be aware of that, always in the back of your mind. I think we don't want to rush anything, and yet I do believe we'll probably get some of the clinical trials results in the 6 to 12-year age group, from Pfizer at least. That should be hopefully available sometime in the fall, maybe winter of this year. So once that information comes out, I think that there will be efforts to try and get vaccines into young people. I suspect it will, assuming it will be safe and effective, and there are no hiccups along the way. In the meantime, it's all the more important for the rest of us to be doing what we need to do. The greatest risk factor for COVID-19 cases being introduced into schools and for outbreaks to occur is high community transmission rates. So when there's a lot of COVID-19 in your community, the school's at risk. The school is an extension of the community. It only makes sense. And so if we can control what's happening around us, we can safely have schools operate. It also means, though, that those other measures that we have, infection control measures, won't be going away from schools, and the importance of them are still there. So ensuring that class sizes are smaller. I think that there's another reason to have smaller class sizes. We have a lot of kids who are behind in school and need more attention. So I think that this pandemic has made a good case in my mind, and this is purely my opinion, that we should have smaller class sizes. Working on increasing ventilation efficiency and having better ventilation systems in schools because of viruses, COVID being today's issue, but in the future, there may be other viral infections as well, and other infections that are transmitted through droplets and particles of various degrees, and can be transmitted in indoor environments with poor ventilation more efficiently. That's important. Masking will probably remain, I'm imagining, with children in school. And all the other measures that have been put into place to try and help with COVID-19, they worked when transmission rates were low in the community.
What's your understanding of the life cycle of this virus? Will it keep spinning off new variants, or and requiring, I guess, an annual booster shot, or will it just at some point die out?
I do believe it's going to continue to circulate. That's sort of the way it's behaving. And while it has the ability to transmit very efficiently in various parts of the world, it will continue to mutate. And some of those mutations will cluster together and turn into and propagate and turn into a variant. And some of those variants will be more transmissible. I mean, it's almost inevitable, if we can't get this under control globally, that we're going to continue to see other variants arise. And some of them may be more have an advantage over what's currently circulating, just as we saw Delta take over Alpha. So that's why this isn't over until we can get things under control globally. This is not a Canada versus India versus Brazil versus Uganda problem. This is the entire world needs to work together on this. So important to look after Canadians, absolutely, and do our best to motivate vaccination here, but we also need to be looking towards what we can do to slow down transmission and enhance vaccination elsewhere. And so given that, I do think that boosters are probably in our future. I don't know what the pattern's going to look like. There's maybe some instability in the sort of the near future in terms of when we see blips in activity of COVID-19. But ultimately, like other respiratory viruses, there may be seasonality that develops. And so it might be that we have sort of not just a flu season, but truly a respiratory virus season where it's not just influenza and the other players that we typically see, but COVID-19. And, perhaps I know there are companies that are already working on this. We'll have combined influenza and COVID-19 vaccines. That would be helpful as well.
Mm-hmm. So case counts are coming down. The weekly case count is under 400. Demands on hospital ICUs and GIM units are certainly starting to ease. We just saw the Toronto General MSICU declare it had no COVID patients today, which is amazing. What can you tell us about the current state in terms of UHN, in terms of visitor access and the resumption of scheduled surgeries? What's your sense, or what's the latest there?
So a caveat I will say is we don't have as many active COVID patients across the University Health Network, but we still have some people who are recovering from their original infection with COVID-19, right? So they're still in hospital. It can cause a prolonged hospitalization. So there's still a bit of a pressure on the hospital. And I expect, like I said, as COVID continues to circulate in the community, we'll probably always have a little bit more COVID-19 within the hospitals as well. But that recovery, I think, is underway, and I think we're going to continue to see some improvements in the numbers and how we're able to manage things. The recovery there's so many different parts to it. There's how do we resume clinical services in a degree where we can provide the services like we did before, but also deal with the backlog of surgical cases, procedural cases, and patients who had medical issues that they just didn't seek attention for. So they deferred their care because they were hoping that they could come into the hospital at a time when things were more stable. We're seeing more people come in acutely ill and sicker in our emergency departments now for medical issues. So there's actually a lot of clinical work that's going on, and it's not possible to just flick a switch and say we're going to ramp up all of our surgery and our procedural care. We have to do it slowly in stages. For things like visitors, we're also doing it in a staged approach because we are trying to be careful as to how many people are within the building at any given time. We're still trying to encourage all this physical distancing requirements and all that. So we're following a framework that's based loosely upon the steps that are in the provincial reopening framework. And that's being used across the Toronto region in all the hospitals. So there are plans in place, but this is kind of what the next phase of the work is. It's about how does the system recover? How do we provide care to patients in this sort of new post-COVID world? And also, how do we support healthcare workers who are exhausted through this and make sure that there's time to recover as well?
Absolutely. I know the evidence to date of the origin of the coronavirus is still weighted towards the Wuhan market, but questions remain, and certainly enough to warrant further investigation, which is continuing. Talk to us about that, the importance of knowing with certainty the origin of the COVID-19.
Right. So if you don't know where it came from, how do we try and prevent this or address this for the future? So to me, that's really what it's about. 2/3 of emerging and new infectious diseases have come from animal origins. We call them zoonoses. So that's the most likely postulate. And certainly with coronaviruses, we know that bats have harbored various coronaviruses. An animal source was what we postulated was a source for SARS, although the actual sources are not clear yet still. So I think trying to understand that is important. It's also a way that we can help to control further introductions and reintroductions into the population. If they're animal reservoirs, then we work really hard on vaccinating people and controlling within people. We're still not addressing that other source that might continue to be that leaky tap, right? So that's what's really important there. If indeed, like some people have postulated, there is a connection to a lab error or something like that, it points to a different route of work that needs to happen, and that's around biosafety and biosecurity and tightening that up internationally. So really it's to help us for the future and to prevent this from ever happening again.
Yes.
If that's possible.
Yes. All right, finally, from me anyway, the pandemic exposed some really disturbing inequities in terms of how we care for our elderly and long-term care in this province. I know you're key, a contributor to developing best practice national standards for long-term care homes. What can you share with us about where that work is at?
Yeah, there's a lot that's underway right now and has been for the last few months. As you know, the Long-Term Care Commission in Ontario provided a very in-depth report of what happened over, especially the first wave, but the first two waves of the pandemic, and that's been a rich source of information. The Ministry of Long-Term Care is also doing some work around this. The Canadian Standards Association is trying to develop some national standards around infection prevention and control and operations in long-term care. So many groups. On a regional level, my colleague, Dr. Johnstone, who works at Sinai Health, is actually leading a regional table where we coordinate some of the way that the hospital sort of hubs are helping long-term care homes with building some expertise in infection prevention and control. So I think we're definitely in a stronger place with the rollout of vaccine and the kinds of supports and connections that we've made within the whole healthcare sector. I think it's much more resilient, but it's going to take years for us to get things to a point where it's functioning really smoothly and long-term care homes are where they want to be and where we all want things to be. So it's a work in progress, but a ton of effort being put into it, and so nice to see that. This was kind of my real introduction to long-term care. I never did infection prevention and control in long-term care prior to the pandemic, and it's been very eye-opening. It's been a very rewarding experience as well. And my team that I built here that does the work with the long-term care has built all kinds of relationships with great folks in these homes. So it is actually, it was actually one of the most tragic parts of the early stages of the pandemic, but it's one of the more positive parts at this stage of the pandemic in my mind.
Well, certainly we thank you, Dr. Hota, for strengthening the quality of care that our seniors get in those long-term care homes. So we appreciate that. All right, enough of me. Let's get to the audience and their questions, which we know have been coming in over while we've been talking. We'll do our best to get to as many of them as possible. First question for you. If you are double vaccinated, can you still pass the virus to unvaccinated people or people on immunosuppressants?
Yes, so that's an excellent question. The short answer is you probably can, but much lower risk in terms of being able to pass on, to get infected yourself and pass it on to others. Some of it does, however, depend on who it is that you're exposing, what their underlying health is. There's a suggestion here about immune suppressants, and definitely if the other person's immune system suppressed, they'd be at higher risk for getting infections. And also what kind of variant you may have. There are some variants out there that we know have, we call it immune escape. So they seem to be less susceptible to the vaccines and less well controlled, I guess, by the immune system. So there is a small possibility. The good news about a lot of these vaccines is when people are vaccinated and get the infection, they tend to have very mild infections compared to if you're not vaccinated. So we have a couple of objectives when we're trying to get vaccination out there. We want to prevent transmission. That's wonderful, but extremely important is prevent the harms of COVID-19, which is, risk of getting hospitalized and really sick.
Okay, next question. Is it safe for fully vaccinated grandparents, i.e. greater than 2 weeks after second dose of Pfizer, to hug non-vaccinated kids under 12 years old? Should masks still be worn?
So this is a really tough one. I would say from a risk perspective, purely as an infectious diseases physician, your risk is low, especially if kids have really been also paying attention to and following the kinds of public health rules that we have right now. It's probably a very low risk interaction. That said, I encourage everyone to follow what's being allowed from the public health unit and from the province that you're living in terms of what you're able to do, who you're able to see, how many people you're able to see, things like that. So there haven't been, we talked about this a little bit, these individual level, I guess, pieces of guidance on who you can hug and who you can get close to after you've been fully vaccinated. It hasn't come out yet, at least in Ontario, but actually in very few jurisdictions. So hopefully we'll get that information to make you feel a little bit more comfortable with your decision.
Next question from Tammy. We've dealt with the first part, but certainly the last part of this question might be some specific guidance from you. Since children under 12 are still unvaccinated, what kinds of precautions should parents take to protect them? Specifically, what activities can unvaccinated children engage in with their peers safely? And I'm guessing people are wondering about going to the beach or the pool or the lake.
Yeah, I mean, in general, outdoor activities are lower risk, and especially if your kids are able to wear their masks when they're going to be within 2 meters of other kids or other people, that's very helpful. So I think, it's summertime. It's important that kids be getting out there, getting active, seeing other people. It's been very isolating for a lot of children, and so I think a lot of those outdoor activities where it's in an open area. And where kids can be wearing masks are safe for them to do. The rest of it kind of comes down to your level of comfort, really, in terms of how many different kids and things like that. If it's within the public health guidelines, it's fine for you to do. But I recognize that everyone has a different threshold of risk tolerance.
Next question. Once we have received 2 vaccinations, how long are we protected?
We don't yet know exactly how long your vaccine-induced immunity lasts. So what we have so far is information from a group of people who were part of the Pfizer and the Moderna clinical trials being followed over time, at least 6 months out from having received their second dose. And the level of protection is quite high. With the Pfizer study, it was over 90%. It was, I think, 91 or 92% protection still at 6 months. So that's really excellent. Given that in the clinical trial where the endpoints were kind of measured, the trials that ended up leading to the authorization of the vaccines showed that we had 95% protection, and then it's only decayed down to 91% at 6 months. To me, that actually implies that we'll be protected for much longer, for maybe a year out, before we would want to think that that boosters would be necessary.
I heard the next question. I heard about many cases spreading among kids in Northern Ontario because the kids aren't vaccinated. Happy that's not the case in Toronto, but why not? Kids aren't vaccinated in Toronto either. But I'd heard Israel was seeing some herd immunity there with so many adults vaccinated. Please explain.
Yes, I mean, it always comes down to the details, doesn't it? And I'm not sure exactly what has led to the transmission amongst the children in some of the communities in Northern Ontario. I do know that there's some fairly widespread outbreaks in those areas, and outbreaks don't really reflect usual kind of circumstances that you come across every day in everyday life. Children are susceptible to getting infected. I just wanted to dispel that myth, because I know some people feel like kids can't get infected, but they can't get COVID. They can get COVID-19. Most kids do get more mild infections, which is a wonderful thing. But there are some children who've had more severe infections or longer term complications. So it's not to be discounted. In Toronto, we have very high uptake of first dose of vaccine. We're working hard on getting second doses up there. So there probably is some indirect protection. But also in Toronto, remember that schools have been closed for a very long time, and children are not interacting with others very much. So it's maybe a different situation here compared to many other parts of even the province, but across the country.
Next question, could we please discuss the wearing of masks and social distancing outside for walkers, runners, bike riders in rain and wind? With all the opening, which I think is premature in brackets, this should be discussed more, I think.
Right. So the way that I see it is risk of transmission outdoors is much, much lower if you're talking to someone who has COVID-19 than if you were in a closed space with that individual. But it's not zero. We know that. So it's a function of the amount of time you're with a person, what kind of activities you're doing together. Are you yelling or singing, where you might actually expel more of these particles into the air? And then how infectious is that person, which we have no way of knowing. Some people will shed virus and will infect other people much more frequently than others, and we don't really know why that is. So we add layers to the whole concept of protection. Outdoors, if you're able to keep distance from an individual more than 2 meters, if it's going to be a short interaction, you're just chatting with them for a very short period of time, I don't believe you need to wear a mask. However, if you're going to be within 2 meters of that person, or you're unsure of whether you'll be within 2 meters of the person, you're going to have more of a prolonged conversation, you would want to wear a mask. That's how we've been approaching it so far.
Next question. My employer is doing rapid antigen screening as an extra layer of protection for those coming into the office. Should I continue to participate once I am fully vaccinated, or is the rapid antigen screening no longer needed? Thanks.
So the caveat here is that you'll have to follow whatever the policy is of your workplace for this. But a few comments. One around rapid antigen testing. It certainly is more of an add-on in my mind, because these tests are very helpful if they come back positive. Someone is very likely to have COVID-19 if they test positive with these rapid antigen tests. But if they test negative, you can miss a substantial number of people who actually have the infection and may not show symptoms yet. So it's not as reliable as doing your PCR test and what you get done when you go to a testing center, for example. So that being said, it's an add-on. You have to follow what your employer would say. I do believe if you've been fully vaccinated, your risk is very low, and this kind of add-on testing, in my mind, has less value. It really doesn't help that much. Your risk of being sick and not symptomatic from it after being fully vaccinated is not really worth having to go through that added screening.
Next question. There are lots of rumors about if you can get COVID twice. What is the scientific research about getting COVID twice?
So at this point, we have some case reports of this happening. That means, people publish in the medical literature one or a small series of cases where they believe this has happened. And it can be a little bit difficult to prove. What people typically do is they try to get the sample of the virus from the first time, if they're able to recover it, and the sample of the virus from the second time, and show that they're different viruses. Because one of the challenges is that you can continue to shed bits and pieces of this virus over time after you've recovered from infection. And our usual sort of testing for COVID-19 relies on a test called a PCR assay, which can detect little fragments of the virus when it's no longer viable inside your secretions and confuse people. So it seems like you've been reinfected when it really just reflects your original infection. So we believe that the risk of actually getting the infection twice is quite low. However, it's not zero, because there have been a few compelling cases that are described.
But we're talking about out of tens of millions of cases around the world.
A handful. Now, there's always a little bit of bias. Like, we don't know if they're under-recognized cases that are happening, and we might learn about this in the future. So like everything else with COVID-19, there's big disclaimers that this might change. And like I said, the variants do change this risk as well. Some of them are less recognizable to the immune system. You don't develop the same kind of immune response that might protect you. So we're aware that there may be a possibility that some people will come back with a second infection, and that might be a higher risk if you've got a compromised immune system, for example. But we really haven't seen examples of it very frequently at all worldwide.
Next, from Diane Freeman. I am a heart transplant recipient 14 years ago at Toronto General. I have had both doses of the Pfizer vaccine. Are you aware of any current studies in which I could enroll that research the efficacy of the vaccine for organ transplants? I am concerned about my level of protection.
Right. So I am not personally aware, but mind you, I may be a little bit behind on what research studies are actually happening. And I can certainly try to find out from our transplant group here if they have any ongoing studies that would be recruiting for this, to find out what your immune response is like over time after getting 2 doses. There is a little bit of data out there that said for some people who don't respond and get a good antibody level in the blood after having 2 doses of vaccine, after having had a recent organ transplant, a 3rd dose might be necessary, and it might be of value, but it's still very early research, and we don't really have a good answer for that yet. So it's something that's being looked at. I'm not sure if our center is recruiting patients for this, but I can certainly find out.
Of the positive COVID cases in Ontario now, how many of them are in people who are already fully vaccinated?
There was a study that was done by Public Health Ontario that looked at what we consider breakthrough, true breakthrough after vaccination. I am not recalling the actual number itself, but it is publicly available if you wanted to search for it on the internet. It's a very small number of true breakthrough cases that have occurred after full vaccination. The majority of cases that have been recorded in those who've received a vaccine have been within the first 3 weeks after having the first dose of the vaccine, in which case we wouldn't necessarily consider that your immune system has had a good chance to have a good response yet. So that's not that surprising that it may happen in individuals who have had their first dose recently. But 2 weeks after your second dose, it was a very small percentage, less than 1% of people in that study.
From Pam, will a third shot of the vaccine help with building a better antibody system against the COVID virus for those who are immune compromised and show low levels antibody response after the second dose?
Right. So this is referring to what I had spoke of just, I think, in 2 questions ago, that there is a little bit of preliminary data to suggest that that third sort of booster type shot might be helpful in people who had transplants, organ transplants, and didn't really mount much of an antibody response after the 2 doses. So I think we should look out for more information on this coming out in the future. And it's very possible that people who are really severely immune compromised would require a third dose.
Next question. With the focus on promoting the vaccine, not a lot of media attention is on actual treatments of COVID. Knowing that COVID and its variants will persist, please comment on treatments currently being researched and their effectiveness, in specific fluvoxamine and ivectormin or other drug repurposing. Yes, I'm sure you know the pronunciation better than me.
So in terms of the treatments, there's not a huge amount on the landscape right now. The most helpful thing that we've had so far has been dexamethasone, which is a steroid. So steroids can be very helpful, but most other treatments have modest effects or have not panned out in clinical trials. The most recent one, so there's also something called tocilizumab, which has also been used to treat people who are getting sicker with COVID. However, we've also faced some shortages of that drug, and it's been a bit difficult to acquire. But in terms of what's coming forward with new treatments, there's monoclonal antibody combinations that we just got some results from a trial called Recovery yesterday that look promising, that they might decrease mortality and improve outcomes in people who are sick with COVID, very sick with COVID. So that's where a lot of the attention has been going, is looking at those kinds of treatments. And things like ivermectin, for example, unfortunately have not panned out consistently in the trials that have been done as being useful treatments. So that work will continue to go on. I agree, most of the attention's on vaccination because that's sort of where we're at the moment. And we've been lucky enough to have multiple vaccines that have successfully made it to this point. We're also hearing about other vaccine candidates that haven't been as successful. So the CureVac vaccine only helped reduce infection in 47% of people and didn't meet its end goal for the clinical trial. So that candidate did not make it. But we'll hear about more treatments as they come forward over time, I hope.
And you know what? I'm going to put in a plug for the UHN podcast Behind the Breakthrough, because we're in production this summer for another launch of season 3 this fall. And we will actually be featuring a number of UHN researchers who have been developing treatments for COVID. So there you go. Next from Barbara, I am experiencing side effects after the second Pfizer vaccination of a very stiff and painful neck. Another has cysts in her breasts. Are these expected side effects and ones that will dissipate? What other side effects have occurred?
So most of the side effects that occur after vaccination are more sort of general systemic things like fever, feeling muscle aches in general. So the stiff neck might be from a muscle tension, as sort of a spasm in muscles that have resulted in that. headache, joint pains, things like that. Even some gastrointestinal effects like diarrhea or nausea can occur. Most commonly, people are sore in the arm or in the area where they got their injection. However, uncommonly, people can get things like enlarged lymph nodes, especially in the areas that are drained from the arms. So that's usually in the armpit area. Very occasionally, there's been some reports in the sort of neck area that the lymph nodes can be enlarged as well. I haven't seen anything about cysts in the breast, so I'm not sure. I can't comment on that. And certainly, if people get side effects where they're not sure that it fits the bill in terms of what they've been told to expect, they should see their family doctors and get checked out.
Absolutely. Here's the one you wanted to hear, Dr. Hota. Is a fourth wave inevitable? If not, what needs to be done to avoid it?
Oh, we can't handle a fourth wave, can we? So inevitable, I'm not sure. And I think it depends on what you consider an actual wave of activity. I really hope we don't get back to a situation where we're seeing such a rise in cases that it would warrant being called its own wave. What I do suspect we're going to see in the future is blips. So we're going to see some increases in transmission, and hopefully we'll get on top of it, or they'll die down quickly enough, and we won't have overwhelming waves like we saw this last time. In order to avoid it, really, it comes down to vaccinating as quickly as possible so we can prevent these variants from taking over and kind of going off on their own trajectory. And whatever the public health measures are that are recommended at the time, for people to just continue to follow it.
Yeah,
it's as simple as that. There's actually no new magic.
No. Next question. As we enter phase 1, I'm guessing that's referring to the provincial reopening, how will UHN manage the elective surgery backlog, in particular oncology, reconstructive related surgeries and day surgeries? I don't know if there's much more we can add to that. We discussed it earlier, but do you know anything specific to these departments?
Not specific to these departments. I guess my overall answer will be, we'll be managing it as best as we possibly can. And I'll just make the comment that it's not just UHN. We're really working as a system. That's one of, again, the positive things that's actually come out of this pandemic, is working as a system. So within the region and within the province, everyone knows this is a major, major issue that we have to tackle together. So if there are efficiencies in the system on how to do this best, they're all being explored.
Next question. Rules about outdoor pools in condo buildings in Toronto. Should guests be allowed to enter pool and pool area, i.e. guests equals people who do not live in the condo building? Is it mandatory for people to still be wearing masks when walking around the pool area when not in the pool?
That's a bit of a tough one, because these are pools that are not public. So I don't think that they fall under the same kind of category in that reopening framework as public pools for the city that are city operated, which have been permitted to open as outdoor areas, the outdoor pools, in this step of the reopening. So I think this is going to have to come to the condo board to see what exactly will be allowed in terms of guests of residents in the building who could be permitted. But regardless, I think that there are rules around the number of people who are permitted in outdoor gatherings. That right now we're still at 10, so we're still at a fairly small number of people that can be considered a gathering together. And people should continue to be mindful of maintaining their masking when they can't maintain 2 meters between others, and also trying to keep physical distance as much as possible.
Next question. Are the vaccines all the same dosage? Are they the same strength for seniors?
Yeah, so within a particular type of vaccine, yes, they are being dosed the same regardless of what your age is or your size. And there isn't a different dosing for seniors. When it comes to small children, because there's such a difference not only in their size, but their sort of biodistribution is different, it's possible that there will be some reduction in the dose of the vaccines compared to what adults would receive. But for seniors and 20-year-olds, you're getting the same thing. And this is why it's especially important that when clinical trials are done, that there's a good representation of people across age groups, across ethnic backgrounds, because we know that metabolisms can be different as well. The way that drugs are metabolized changes according to your genetics. So larger trials that have representation across these different groups and across people with different health issues as well. And these trials that we have for Pfizer, Moderna, AstraZeneca were large. And we've also now had millions of people vaccinated. And at this point, I have not seen anything that suggested that we should have different dosages based upon weight or upon age.
When roughly will it be safe to return to the office without the need to wear masks if we knew all staff members are double vaxxed? What safety protocol should be followed when we return?
Again, this will have to follow what your province or your public health unit is telling you is possible to do within indoor settings. And that's being decided according to the reopening framework in the province, but also looking at what's happening with, as we call it, the epidemiology, the numbers, and what we're achieving with keeping these variants at bay. So it's a little hard for me to say. I think at the moment, it looks like the mask order has been extended at least until September, is my understanding. So we won't expect to see things move away too quickly from indoor masking. But beyond that, you're just going to have to wait and see what the province will say.
And last question, which is a first in all our COVID live streams, Dr. Hota, you have the distinction of getting through every single audience question, which is, I think, yeah. If you have received both vaccinations, is it safe to travel by air? If so, what safety measures would you recommend for flying?
Right. So you're definitely in a good place if you've gotten both vaccines and you're needing to travel by air. Again, the issues are really around being near many different people, some who are coming from different parts of the world or the country, and just mixing of populations, as I put it. So it's all the same sorts of things as we've talked about already. Wearing your mask, making sure you have a good quality mask that fits you well is important as well, because even being doubly vaccinated, as I've mentioned, nothing is 100% effective in protecting you entirely. And you don't know who's around you and what they may have been exposed to. Washing your hands is important, although there is such an emphasis on cleaning surfaces and things like that early in the pandemic. And then we recognized, you know what, the environmental transmission is probably far less important than any kind of respiratory transmission of the virus. It remains important when you're dealing with surfaces that are touched by many different people over short periods of time. Then you have an actual risk of somebody having expelled virus onto a surface and you very shortly thereafter touching it and transferring it. So it is still relevant. It's not something to entirely discount. So washing your hands frequently is a very good, easy way to do that. And while you're on the plane, just again, being masked, the air exchanges within a plane, it's filtered air, but the exchanges of that air is quite frequent. So planes are actually not as bad as you probably initially feel in terms of your risk of being exposed to these kinds of viruses. Try to keep your distance from people as much as possible where you can. And complying by the testing and other rules that are required wherever it is that you're traveling.
Well, I want to thank the audience for all those thoughtful questions, and to Dr. Susy Hota, Medical Director of Infection Prevention and Control at UHN. Thanks so much for taking the time to be with us. I know you are slammed with infection and prevention control at UHN, so we really appreciate you being here today.
You're very welcome.
This live stream will be available on the UHN Foundation YouTube page. And finally, donor support. Your dollars fuel research initiatives of our UHN scientists working to improve and discover new treatments for patients suffering from COVID-19. If you're able to give, we ask you to consider making a donation. Go to our website, www.uhnfoundation.ca/help. That's uhnfoundation.ca/help. Thanks for tuning in, everyone. We'll be back next month with another episode. Keep an eye on your email inbox for details. In the meantime, keep practicing physical distancing, wash your hands often, mask up, and get vaccinated. Stay safe, everyone.